Hi my beauties, welcome to Younger. I'm Dr. Stefani Kappel. I'm a board certified dermatologist, and today I'm going to be talking about skin tightening devices. And before I go on, I'd ask that you like, subscribe, and comment on my page, and maybe share this video with somebody who would be interested in skin tightening or a little bit of information on skin tightening devices that we use in dermatology and plastic surgery. So the reason why I wanted to talk about this topic, it's a rapidly advancing field. The technology that's coming down the pipeline is amazing. It's awesome. There's a lot that we can do today that we couldn't do years ago with respect to tightening skin and helping fine lines and wrinkles, helping loose sagging skin, and also taking a more preventative measure to build collagen to prevent aging from happening in decades to come. So there's several new devices on the market. There's several devices that have been on the market that have rapidly advanced in the technology with respect to the protocols, the different hand pieces that we use, and the energy that we use to tighten the skin in the form of heat. So just to kind of clarify what a laser or a tightening device is, a laser is a light-based device, and this is used for resurfacing. It can also help with fine lines and wrinkles, but that's a different category than the tightening devices. Although lasers can sometimes stimulate collagen and tighten skin, there are devices which we call either energy-based devices or tightening devices that use different forms of energy in the form of heat that go into the skin and stimulate our bodies and our skin to make collagen. Now, the skin cells in the skin that make the collagen are called fibroblasts. And the easiest way, like when I was a professor at UCLA, when I would explain this to the dermatology residents, the way that these energy-based devices get heat into the skin to stimulate collagen and give the skin a more youthful, tight, and smooth appearance is by stimulating collagen by the different signal transduction cascades or the different pathways that get activated to make collagen. Now, putting that in layman's terms, what happens is whenever we have heat in the skin, it stimulates collagen. If you look at a burn victim, they have terrible scarring, and their scars are these plaque-like, smooth, shiny surfaces. If you ever look at a burn scar, that's what burn scars look like. And what that is there's a bunch of collagen that's made in the form of scar tissue, which gives this very shiny, smooth, wrinkle-free, youthful appearance. Now, we're not trying to induce scar formation in patients, but what it is when we use these energy-based devices to stimulate collagen, it is a very elegant method and a very controlled wound healing that we're inducing in the skin. So what happens is when heat is dumped into the skin, whether it be through light, through microwave, through radio frequency, through ultrasound, through microfocus ultrasound, all we're doing is we're using these technologies and these devices to put heat into the skin, and it's like a controlled wound healing environment. Your body's going to respond by upregulating the synthesis of collagen and making that skin smooth, tight, and strong. So although we don't want to induce scarring in patients, what we do is we just smooth the skin and help with the appearance of fine lines and wrinkles and help get crepey skin to be tighter and smoother. Now, tightening devices started off being used on the face, of course, for under eye wrinkles, for sharpening the jawline, to get rid of jowls, to lift and pull up on the face, and then they were used on the neck, and they were used on the décolleté and the chest for sleep creases and creasing and crepey skin that we get on the chest. Then we started using them off site areas like the body, so in the abdomen, sometimes young moms after having babies, or even years after having babies, or after having a significant weight loss or having liposuction. These tightening devices were used on the stomach, the abdomen, even on the arms when their skin gets crepey on the arms and kind of loses its elasticity, the legs, above the knees. And so it's a rapidly advancing field with all these competitive companies in the device and laser world trying to improve on the technology to tighten skin, not only on the face but everywhere. So when you look at the three most commonly talked about or discussed in the peer-reviewed literature at our dermatology and plastic surgery meetings, and on the market in the medical device community, you hear about Thermage, you hear about Thermatite, you may hear about Ultherapy, you may hear about VeloShape, UltraShape. There's different tightening devices or but energy-based devices that are used to stimulate collagen and tighten the skin. And so I do have my favorites, and after doing a laser and device aesthetic fellowship after my dermatology residency, I had the honor and the experience to be able to use a lot of these devices and see what works, what doesn't, and we actually participated in a lot of the initial clinical trials where we compared head-to-head studies of these different devices and differences between the different protocols or different handpieces of these devices. So I come from a background where I've had a lot of experience with these devices. I use them on a day-to-day basis in different offices on my patients, and I have an idea of what works, what doesn't, not only based on anecdotal evidence from my patients and feedback, but just what we discuss at our society meetings, what's published in our peer-reviewed journal, and for a more science background and backing up the results and the outcomes with scientific data and real results that have statistical significance. So backing up, when you talk about these devices and how they work, the good thing about most of them is there's little to no downtime. So unlike sometimes a laser resurfacing or a chemical peel or certain types of lasers that get rid of brown spots or red spots, there really isn't much downtime with respect to the tightening devices. So for example, Ultherapy, which uses microfocus ultrasound, you sometimes will have a little bit of discomfort during the procedure, but using medications such as like an ibuprofen or sometimes an anxiolytic like an Ativan or even some Vicodin or Dilaudid, sometimes we give these patients medications to make it more comfortable during the procedure, so it's not pain-free or painless, but the discomfort level can be greatly controlled by using medications in the office setting. So you don't need general anesthesia in an OR and intubation with an anesthesiologist. It's a little bit more low-key. You're in the office and we give you a little medication to make you feel good. We usually have you come with a driver and we do the treatment then and there. It takes about an hour, and when you leave, there's little to no downtime. Sometimes when Ultherapy first came out, we heard a lot about bruising. I personally haven't seen much bruising in my practice. My colleagues have not either. We don't really report that at our meetings. So usually you walk out of there, you may be a little bit red from the numbing cream or from the pressure of the device being put on the skin that lasts about an hour or two, and then there's really no downtime. Same with Thermage. When you have the treatment, you walk out of the office and it looks as though nothing was done. Your skin initially may be tighter. You'll feel that your skin feels tighter because there is a contraction of the collagen fibers that are already existing in the skin after the Thermage treatment, and then later on, months later, your body's going to be stimulated to make collagen down the line. So 4 to 6 months later, you'll definitely notice an improvement, but just when you leave the office, your skin will look and feel tighter as well. And then when we go to different devices such as VeloShape, this requires more of a maintenance, so you do get a tightening effect, and you usually have to have several treatments, usually 4 to 6 within a treatment session, spaced about 1 week apart to get the result. And then to maintain it, you usually have to do it once a month or once every 1 to 2 months to maintain the result. So because of that, and my job's not to bash any device companies or say anything negative about them, but I want you guys to know, what my opinion is, what the difference is, and the pros and cons to each of these. So one of the downsides of VeloShape is that it does require maintenance, so it's not my favorite. I'm more of a one and done, let's get it taken care of, and I don't want to have to come in for several different treatments and have it over with. So with Ultherapy and Thermage, I really like those medical grade tightening devices because it's a one-time treatment. You can do it as often as every 6 months or every 12 months, but it's actually not recommended to do it within less than that time period because you're still getting the results of your first treatment 6 months later. So if you wanted to, we have some patients who are very OCD, they look amazing, but they come in once a year for their Thermage treatment to, say, tighten the skin on their face or maybe their chest, or maybe their stomach, or maybe their arms, and they look great, but it's not so much that the results from the tightening device wear off, it's more that, okay, I've aged, I'm a year older now, and I've lost collagen, I want to stimulate more. So there's this theory that a lot of the companies call collagen banking. Collagen banking is a new theory that now exists that didn't exist years ago. And this is more of the preventative approach to stimulate collagen. So each year, each decade, sadly, we lose collagen, and that's what gives skin that crepey, wrinkly look. And so we want to collagen bake. You want to restore your collagen. You want to stimulate your body to make collagen so that the years down the line as you lose collagen, you have reserves and you have more than you would otherwise if you weren't doing these treatments. So my patients who are younger and in their 20s and 30s and 40s, we recommend these treatments to kind of keep up your reserves, so when you enter your 50s or 60s or 70s, you're going to look a lot better, because as you lose collagen, you have reserves backing you up. And so it's a very great preventative measure that I recommend for my younger patients. Now, once you do reach, your 50s, 60s, 70s, or even if you have some premature aging or crepiness of your skin elsewhere, it can reverse the clock, and it can reverse any of that damage or photo damage or loss of elasticity or loss of collagen that has occurred, and can rewind the clock and make you look younger. But we always say, an ounce of prevention is worth a pound of cure. If you can kind of be more proactive and stimulate collagen so that you have reserves down the line, it's always better. Now, the radiofrequency devices like Thermage, sometimes you'll see them being called monopolar or bipolar. So in the research data and literature, and among most of my colleagues, we do prefer the monopolar radiofrequency. Now, what happens is the radiofrequency goes through the skin, and they usually give you a grounding pad that you put on the other side of your body, because you want that radiofrequency to penetrate deep into the skin and exit out the body. That sounds scary, but it's very safe, it's very effective, and there's no deleterious effects on your health. They've done a lot of studies, and as long as you don't have a pacemaker or you're pregnant, those are the only two contraindications to doing the procedure. And we can also do it up and around the eyes for a very significant tightening effect. So patients who may have heavy overhanging lids or the hooding of the upper eyelid, if they don't want to undergo an eyelid surgery, which we call a blepharoplasty, we've had really amazing results using these tightening devices to kind of tighten up that skin. Now, usually we have to put in some eye shields. It's not a big deal. It just protects the globe of the eye, and we just run the machine over the eyelid. It's nearly painless, and it takes several minutes, and it's done. And so the results have been really impressive. I'm very impressed by the research data and literature and the results that my patients have gotten from this procedure. So whether it's to sharpen the jawline, whether it's for a brow lift or to open the eyes, there are several different areas on the body that we can use these tightening devices. And the reason why we can use them on these areas of the body is because there's different hand pieces that are engineered specifically for those areas of the face, and we can control the settings for the depth and for the intensity of the radiofrequency energy that's being emitted into the skin. For instance, the mid-center of the cheek is a little bit more fatty, that skin's a little bit thicker. The settings are going to be a little bit stronger there than they would be on the eyelid, where that skin is very thin, or on the neck where the skin is thinner. So there's different settings, different hand pieces, and different techniques that we use for different areas of the face or the body or the extremities that give us the results that we're looking for. So kind of moving along, there are minimally invasive, which are pseudo-invasive energy-based devices as well. Thermatite is another one. So during my fellowship, we did some of the investigative research regarding the Thermatite device. I really liked that device. However, it is a little invasive and it is a little uncomfortable for the patient, because what it is it's a wand. It's about this long. It's a cannula, and we make a little incision. We numb the whole area first so you don't feel any of this, and we insert a cannula right under the skin. And on the tip of that cannula, it's almost like it radiates this almond-shaped radiofrequency emission from the tip of the cannula, and we kind of thread it underneath the neck, we thread it underneath the skin, and it does tighten the skin and stimulate collagen. However, the reason why I wasn't as big of a fan of Thermatite, although it does really work well, I really believe and have seen that you can achieve the same results with just a non-invasive device like Ultherapy or Thermage, where it's not breaking the skin, it's not going through any incisions in the skin, it's gently being placed on top of the skin, and the radiofrequency emission underneath the skin is going to stimulate collagen and stimulate that tightening effect. So between Thermage, Ultherapy, Thermatite, I have to say I believe Thermage is one of my favorites. And in private practice here in Newport Beach, we've had our choices to make regarding which energy-based device that we're going to purchase, and we ended up getting a Thermage, and we just got that today, and I'm very excited about it. And this was after doing a lot of investigative research on tightening devices, which is what prompted me to do a YouTube episode on tightening devices, because I've done all the legwork with respect to the literature, not only in the peer-reviewed research, but also talking among colleagues and looking at before and after pictures, and taking into consideration how long this device has been on the market and how many improvements have been made. So if you look at the iPhone, each year or each couple years they make improvements, and so the 10 is going to be a lot better than the 7 or 8. And so just because Thermage has been around for a while, it doesn't mean that it's a less of a device or the results are subpar. It's just that they've made a lot of improvements on it, and I feel that it's a little bit less painful than Ultherapy, and I've been impressed with the results. So just to move on what you would expect on having one of these energy-based device treatments in the clinic or in an inpatient or outpatient setting. So basically, when you arrive, if you have a driver, sometimes we'll give you a little medication to kind of calm you down, but it's really not even necessary, especially with Thermage. And we don't even use a numbing cream. We use a coupling gel, so the gel gets placed on your face. Sometimes we could put a little, it's almost like a child's tattoo, like a grid that's on the sticker, and you basically put the sticker on the face so that we can see the exact placement of the handpiece when we're being very meticulous and precise with where we're giving the treatment. And takes about, I would say, maybe 10 minutes for each side of the face, maybe another 10 minutes for the forehead if we want to do it along the jawline or add in the neck. It could be anywhere from like an hour to an hour and a half, and then you leave the office and then you forget it ever happened. Your skin's going to look a little bit better and a little tighter right away. Again, that's because you get collagen contraction that's in real time as the device is dumping heat into the skin. And then they say that about 2 months later, you'll start to see an improvement, and then each month after that, up until about 6 months, you'll get 40 to 80% improvement within that short amount of time. So it's not right away, and the reason why it's not right away is because you're inducing your body's own regenerative system to make collagen and to make the skin act and behave younger. So whenever you induce your body to do the work, it's like I always say, it's like working out, going to the gym. You're going to lift heavy weights, you're going to become hypertrophic or bigger in your muscles, you're going to go home, you're going to eat protein, and you're going to build. And so it doesn't happen right away, but over time, as you're going to the gym or as you're doing these skin tightening device procedures, you're going to experience that downstream effect that may take place months later. But you'll all of a sudden start looking younger, not older, as the months go on. And so I always like to also say that after the treatment, you know, we always like you to follow up about 6 to 12 months later, and usually you're going to ride on those results in case, you know, 2 to 3 years go by and you're 2 to 3 years older and you want a little refresher, then that's fine. But I think that it's also great for, like I said, my younger patients to stay on top of it and to do maybe a little tightening treatment on the neck to keep their neck smooth and firm and prevent it from happening, you know, too early with any premature aging. So it's always a good idea to tighten the skin, to stimulate collagen, and we've had great success. There's little to no side effects of this procedure. I'm a big fan, and many of you may be asking or wondering about the at-home devices. So I can't really say anything good or bad about the home devices. I know that there's NuFace, I know that there's a lot that you can buy on Amazon, and there's different radio frequency home devices. The thing is that any home device is not going to be of the potency that a medical grade would be. So there's no real peer-reviewed literature or data or science supporting the at-home devices. But as a dermatologist, I haven't seen really any negative side effects from it. I don't think that it could do any harm. So if anything, if the worst case scenario, you may be just wasting your time. But you know, it's hard for me to support an at-home radio frequency or tightening device without really sound literature or head-to-head studies. But if it makes you feel better, or if you're noticing a result and you're not noticing anything bad happening, then by all means just go ahead and go for it. But you're not going to get the response from an at-home device that you're going to get in medical grade. And they're medical grade for a reason. Physicians can perform these procedures. RNs are also extenders that can perform these procedures, but you need a higher level of training to perform these procedures. The last thing that I wanted to say is I remember I was sitting at an academy meeting among dermatologists and plastic surgeons, and I remember sitting in the audience and hearing one of my ex-professors speak, and they were talking about stimulating collagen in the 50s and 60s in 60-year-old patients who have never had a procedure before. Now, although it is harder to induce their skin to make collagen, it is possible, but they may not be getting, that patient population may not get the biggest bang for the buck as someone who is in their 40s or 30s or someone who has been doing it up until that point. It's kind of like working out, again, I always use this analogy, but someone who's been lifting weights and working out their entire lives, they're walking around their 40s and 50s with these cut up arms, they're looking bomb in the gym. They didn't just start working out. Their body has been conditioned their entire life to to have this physique and to lift and to train. And by doing that over time and making it part of your lifestyle or your overall health, you'll get a better response. So patients who start earlier, their bodies will be tuned in and be more responsive to any stimulus that's going to make them stimulate collagen synthesis. So, for example, someone starting this procedure in their 20s or 30s or even in their 40s, if they're inducing their body to make collagen 5-10 years down the road when they have another treatment, then they're going to be more responsive to stimulating and producing collagen, versus someone who is maybe 60 years old and has never done it before. It's a little bit harder to induce their skin to rev up and start being active again. It is possible, but that jump that they take isn't as big as someone who has started it earlier. So that's not to say that it's a waste of resources or money or time. It definitely will help pay off, especially if someone does not want to have surgery. It's still a good thing, and it can't hurt you. It's only going to activate your skin to behave healthier and act younger on a histological level by inducing it to do the work to look better. Sometimes patients ask me, well, I plan on having a facelift in a couple years, so should I just not even bother doing this? And the answer is no. So speaking with my plastic surgeons colleagues, when a plastic surgeon is doing something like a facelift or a neck lift or a blepharoplasty, which is the eyelid surgery, they're essentially operating on younger skin when you have had radiofrequency, microfocus ultrasound, or any other energy-based device treatment. And the reason is because younger skin has more collagen, and somebody who is older and who has had these energy-based device treatments has more collagen in their skin, so the skin is acting and behaving and going to heal younger. So the facelift will last a longer period of time. The neck lift will last a longer period of time. And again, this is after discussion with my plastic surgeon colleagues, and also based on literature review of controlled studies where they're doing head-to-head comparison on the outcomes of surgery and the duration of surgery and how long the surgical results last on skin that has and has not been treated by energy-based devices to stimulate collagen. So there's a lot in the literature out there. It can be very confusing when you're looking online or doing research on what these energy-based devices do, how do they tighten skin, how long do they last, where can you have these performed. And so I hope I answered a lot of your questions. But if you have any questions, post some comments, I'll respond to them. Again, it can't hurt you, it's only a good thing. You want to induce your skin to act and behave younger, and the technology has come such a long way that we're now collagen banking and trying to be more proactive on the aging process and stimulating your body to make that collagen so that we have reserves. I hope you find this useful. Again, please like, subscribe, and comment to this video, and share this video with anyone else who you may think that this would, they'd find this helpful. So I hope you guys enjoyed it, and let me know what else you guys want to hear about. Thank you for staying tuned, and we'll see you soon.